Why isn't everybody doing it? And what do people like let's say Nobel or Neodan or Straumann, what do they have to say about this?
I think that they don't see the future of it. I think that they don't see how important it is, and they will. And this is the future. In the standard right now, it's what everybody that's in the know is doing it.
Okay.
But I think that they will start to use this because it is the best. And I know because I've used it on my own patients, and I have long-term studies on it, and I have so many doctors that use this. And I'm telling you, hundreds of thousands of screws that we've done for patients, and I hear the, how do you say, the reviews from the dentist that say this is unbelievable. Send me more.
It's the way to go.
Yeah.
And so most of these implant companies, you've got the engineers, then you got the sales team, and then the marketing team. So it's kind of slow to change.
Yeah, it's not only slow to change.
And still enough dentists are complaining, or they don't know what they don't know. They don't know that there's a better way.
Yeah.
But they don't believe it.
They don't understand why when their cases fail or when they have a complication, why they had it. They just assume it's someone else's fault. But I always say, it's the doctor. If you chose the product, you decided that's the best for your patient.
And what do you call it?
Powerball screw.
Just Powerball screw.
That's it.
But does that mean that they have to kind of depart from, whoever they're currently using, as far as implant the systems and things like that?
It's compatible with all the implants. That's the beauty. It's compatible, and there's no excuse for it. It's like I always tell people, you do so much work to get your patient healthy. You do so much work to do the surgery. You do so much work to get the smile perfect. Everything you did is perfect. Now, would you want all of that to be held by something that's tiny and cheap, or something that's robust and tested, and something that's going to hold everything in for a really long time? What would you want? What would you want, Randy, if it was your mouth?
So they're taking a $20 cheap way out.
Yeah, to save $20 after they collected $30,000 from their patient.
Do you have people that once they switch over or give this a try, they don't go back?
No, never.
So your reorders are big?
Yeah, I mean, we don't lose customers.
Is it, so do you get mostly the onesie-twosie crowd, or are you getting the full arch crowd?
I get everything. I have from massive corporate companies that error is not possible for them because they are able to track everything that order them, to just the typical dentist that does maybe 10 implants a month or 10 implants a year that can order it. We don't have any minimum orders. I want everybody to be able to use this because I want the patients to have the best in their mouth. That was my goal, to always do this, because I could only treat so many patients. And if my invention can be in someone's mouth, if I just saw a case on a patient that had their work done in France and is being held by my Powerball screw.